Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today we will start the anatomy of female reproductive system. Let's start with anatomy of ovary. So in this video we will learn the name of the organs under female reproductive system, and then we will start with anatomy of ovary. We will learn the external anatomy and histology of ovary along with its blood supply, nerve supply and lymphatic drainage. Let's start. The female reproductive system consists of internal genital organs, external genital organs and accessory reproductive organs. The internal genital organs includes ovaries, uterus, uterine tubes and vagina. External genital organs includes mons pubis, labia majora, labia minora, clitoris, vestibule of the vagina, bulbs of the vestibule, greater vestibular glands. And the breast is the accessory reproductive organs. These organs play a role in the reproduction, and the female reproductive system is immature at birth in humans and develops to maturity at puberty, and then it is able to produce gametes and can carry a fetus to full term. So let's start with internal genital organs. At first, ovaries. The ovaries are a pair of female reproductive glands situated on either side of the uterus in the ovarian fossa below the pelvic beam attached to the broad ligament. The primary functions of ovaries are to produce oocytes for fertilization and to secrete female hormones like estrogen and progesterone. Each ovary lies in the ovarian fossa on the lateral pelvic wall. Okay. And the ovarian fossa is bounded posteriorly by the ureter and internal iliac vessels, anteriorly by the external iliac vessels, inferiorly by the uterine tubes. And the obturator nerve and vessels cross the floor of the fossa. Next, coming to the position of the ovary. Position varies whether the woman is nulliparous or multiparous. In nulliparous woman, its long axis is nearly vertical so that the ovary is usually described as having an upper pole and a lower pole. And in multiparous woman, the long axis becomes horizontal so that the upper pole pointed laterally and the lower pole medially. Ovaries are an almond-shaped organ. The size of ovary, vertically it is 3 cm, antero-posteriorly it is 1.5 cm and transversely it is 1 cm. And the external features of the ovary in young girls, before the onset of ovulation, the ovaries have a smooth surface which are greyish pink in color. But after puberty, the surface becomes uneven and the color changes from pink to grey. Each ovary consists of two ends, two borders and two surfaces. First is ends or poles. There are two ends, tubal end and uterine end. The tubal end is related to the uterine tube, fimbria and suspensory ligament of ovary, and the uterine end is connected to the lateral angle of the uterus by ligament of ovary. Next, coming to the borders. There are two borders, anterior border and posterior border. The anterior border is also known as mesovarian border. It is attached to the broad ligament and act as a hilum of the ovary, conveying the ovarian vessels and nerves. And the posterior border is also known as free border and it is related to uterine tube. Next is surfaces. There are two surfaces, medial surface and lateral surface. Medial surface is related to uterine tube and lateral surface rests on ovarian fossa. The ovarian fossa is bounded above and in front by obliterate umbilical artery, above by external iliac vein and behind by ureter and internal iliac vessels and laterally by peritoneum. Next, coming to relations. There are two relations, peritoneal relations and visceral relations. First is peritoneal relations. The ovary is almost entirely covered with peritoneum. The ovary is connected to the posterior layer of the broad ligament by a short fold of peritoneum which is known as mesovarium. The mesovarium transmits the vessels and nerves to and from the ovary, and the lateral part of the broad ligament of uterus is the suspensory ligament of the ovary or infundibulopelvic ligament. It contains the ovarian vessels and nerves. Next, coming to the visceral relation. The upper or tubal pole or tubal end is related to the uterine tube and external iliac vein. The lower or uterine pole or uterine end is related to the pelvic floor. The anterior or mesovarian border is related to the uterine tube. The posterior or free border is related to uterine tube and ureter, and the lateral surface is related to ovarian fossa and the medial surface is related to uterine tube. Next, coming to the ligaments of ovary. The ovary is primarily held in place by two main ligaments, ovarian ligament and suspensory ligament. Ovarian ligament connects the ovary to the uterus, and the suspensory ligament extends from ovary to the pelvic side wall carrying ovarian vessels and nerves. And additionally, the mesovarium also supports the ovary by attaching it to the broad ligament. Next, coming to the histology of ovary. The ovary is covered by a single layer of cubical cells which is known as germinal epithelium, and the substance of the gland can be divided into outer cortex and inner medulla. The medulla is composed of loose connective tissue, muscle fibers, blood vessels, lymphatics and nerves, and the cortex includes ovarian follicles at different stages of adulthood and maturation. And instantly beneath the germinal epithelium, the connective tissue of the cortex is condensed to create a fibrous coat which is known as tunica albuginea. So let's learn in details about ovarian follicles. In last slide, we have already learned that the cortex contains the ovarian follicles at various stages of development, and it can be classified as primordial follicle, primary follicle, Graafian follicle and corpus luteum. So first is primordial follicle. It consists of a primary oocyte surrounded by a single layer of flattened cells. Next is primary follicle. Each primary follicle has a primary oocyte surrounded by a single layer of cuboidal cells. And the primary oocyte has a large nucleus with prominent nucleolus and pale chromatin. And the cytoplasm is also pale and granular. Next, coming to the secondary follicle. Here the follicular epithelial cells proliferate and become many layered, and the primary oocyte also increases in size. As the oocyte grows, a thick non-cellular membrane called zona pellucida develops around it. Next, coming to the Graafian follicle or a mature follicle. As the follicles develops, there is a formation of a single crescentic cavity which is known as antrum. And antrum is filled with clear fluid which is known as liquor folliculi. At this stage, the primary oocyte lies on the side of the cavity. The follicular cells which surround the ovum are called the cumulus oophorus. You can see it in the picture. Stroma around the follicle. Stroma is the supporting connective tissue framework of the ovarian cortex. So the stroma around the follicle arranges itself into an inner theca interna which is vascular as well as cellular, and an outer theca externa which is fibrous. You can see in the picture the theca interna and theca externa. The cells of theca interna secrete estrogens and the follicle bulges onto the surface of ovary, such a follicle which is called Graafian follicle. The function of Graafian follicle is to form mature ova, secretes estrogen and provides a medium for the growth of corpus luteum. We will discuss what is corpus luteum in next slide. So the primary oocyte undergoes the first mitotic division and becomes the secondary oocyte, and in this state it bursts from the follicle. And the follicular cells which still surround the secondary oocyte are called corona radiata cells, and the rupture of follicle with liberation of secondary oocyte, this process is called ovulation. And there are many follicles, they do not develop fully but degenerate, and these follicles are called atretic follicles. These follicles secrete estrogens. Next, coming to the corpus luteum. After rupture of the follicle, the liberation of secondary oocyte, the granulosa or follicular cells becomes enlarged, accumulate lipid and are transformed into pale staining polygonal cells which are called lutein cells. And the theca interna cells are smaller, fewer and dark staining, and these are termed as prolutein cells, and capillaries and fibroblasts grow into these cells and the follicle is called corpus luteum. Corpus luteum secretes chiefly progesterone and some estrogens for 10 to 12 days if there is no pregnancy, and for 3 months if there is pregnancy. So after its function over, the cells of the corpus luteum shrinks in size and leave a white scar which is known as corpus albicans. You can see in the picture the corpus luteum and corpus albicans. Next, coming to the arterial supply of ovary. The ovarian artery arises from the abdominal aorta just below the renal artery, and it descends over the posterior abdominal wall and enters the suspensory ligament of the ovary. It sends branches to the ovary through the mesovarium and continues medially through the broad ligament of the uterus to anastomose with the uterine artery. Next, coming to the venous drainage. The veins emerge at the hilus and form a pampiniform plexus around the artery, and the plexus condenses into a single ovarian vein near the pelvic inlet, and this vein ascends on the posterior abdominal wall and drains into the inferior vena cava on the right side and into the left renal vein on the left side. Next, coming to the lymphatic drainage. The lymphatic drain into pre-aortic and lateral aortic lymph nodes following ovarian vessels. Next, coming to the nerve supply. The ovarian plexus contains both sympathetic and parasympathetic nerves. The sympathetic nerves includes thoracic 10 and thoracic 11 are the afferent as well as efferent or vasomotor, and the parasympathetic nerves that is sacral 2nd to sacral 4th are vasodilators. The next part of this topic will coming soon. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for nurses. And for any suggestions or for any queries, you are most welcome to comment. Thank you for watching.